Hello everyone. Today my friend and myself going to present about stress during MCO COVID-19. Let me introduce myself. I am Abhirami Ponudurai from batch 19. Mental health issues are the leading impediment to academic success. Mental illness can affect students' motivation, concentration and social interactions. Crucial factors for students to succeed in higher education. The 2019 annual report of the Center of Collegiate Mental Health report that anxiety continues to be the most common problem among students who completed the counseling center assessment of psychological symptoms, with clinicians also reporting that anxiety continues to be the most common diagnosis of the students that seek service at university counseling centers. Consistent with the national trend, Texas A&M University has seen a rise in the number of students seeking service for anxiety disorder over the past 8 years. In 2018, slightly over 50% of students reported anxiety as the main reason for seeking service. Despite the increasing need for mental health care service at post-secondary institutions, alarmingly on a small portion of students committing suicide contact their institution counseling centers, perhaps due to the stigma associated with mental health. Such negative stigma surrounding mental health diagnosis and care has been found to correlate with a reduction in adherence to treatment and even early termination of treatment.
Hi, my name is Vaitushari Suppaya. Today I want to present about factors of stress during MCO COVID-19. For parents and children, parents are unable to stop their anger. Parents start hitting your child out of frustration. Parents cannot stop screaming louder and louder. Secondly, parents are unable to connect emotionally with your child. Parents feel irritated and overwhelmed when they are requested for attention. Parents just want to look yourself up into the room and have some peace and quiet away from them. Finally, parents unable to meet your child's daily needs. Parents don't find joy in feeding them or helping them with their homework or any activity. Parents struggle with the simple tasks like reading and bedtime story or spending time playing a board game. Then, for teachers and students, challenges with online teaching. Many universities and colleges were forced to make swift change to move to online teaching when MCO was imposed. But these come with several challenges. First, even if students and lecturers can get past the technical difficulties, one cannot assume that all tertiary students enjoy unlimited internet access or possess laptops or desktops that allow them to attend online classes freely. Finally, administrative challenges. Administrators in their tertiary education sector will also face difficulty in reorganizing the schedule of their respective schools, and it's possible the school semester enrollment of new students and hiring of new staff will all be affected because of the MCU.
I want I want to present about reason why stress during MCO COVID-19. Being under of being under lots of pressure and not having enough work, activities or change in your life. As government strict to protect the public, the economy and their essential workers, entire industry are buckling and families are locked down in their homes trying to juggle work and domestic commitments on remote and as best they can. Worrying about something, difficulty concentrating and making decision, difficulty sleeping or nightmares, physical reactions such as headaches, body pains, and stomach problems. Not having much or any controls over the outcome of a situation, worrying and make it seems like you have some control over uncertain circumstances. You may believe that it will help you find a solution to your problems or prepare you for the worst and be able to control the causes.
Hi everyone, my name is Praveen Raj Annalaki Balu from batch 19. Today I want to present about how to overcome stress during MCO COVID-19. Firstly, protect your media conspiration. Seek out reliable news such as the Center for Disease Control or Prevention CDC or your state health board for the latest information about COVID-19. However, we recommend limiting the news to less a few times per day. Second one, get outside. No matter what the reason, take an opportunity to get outside and experience nature by center. Open back up, do some clean up outdoors. Finally, get creative using your hand and creative brain can be a great way to relieve stress. It helps you focus on the present and create something new. If you have art and craft supplies on hand, use them to create something special. Thank you very much.
To prevent the spread of COVID-19, we must clean our hands often. Use soap and water or an alcohol-based hand rub. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask when physical distancing is not possible. Don't touch your eyes, nose or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough or difficulty breathing, seek medical attention. Calling in advance allow your healthcare provider to quickly direct you to the right health facility. This protects you and prevents the spread of virus and other infections. Mask can help prevent the spread of the virus from the person wearing the mask to others. Masks alone do not protect against COVID-19 and should be combined with physical distancing and hand hygiene. Follow the advice provided by your local health authority.
Hi everyone, my name is Nishni from batch 19. I am the last presenter for this group. Today I am going to present conclusion about stress during MCO COVID-19. There was a moderate to high level of stress among public to start of the COVID-19 outbreak. The integration of online counseling and stress management program will help mitigate the stress of students during distance learning. The coronavirus disease continues to spread across the world following a trajectory that is difficult to predict. The health, humanitarian and social economy policy adopted by countries will determine the speed and the strength of the recovery. And finally, I would like to thank the MOH in Malaysia and many professionals including doctors, nurses, police officers, soldiers, garbage collectors and cleaners who have been at the forefront in responding to the pandemic COVID-19 outbreak. All from us. Thank you so much.